I've had pain for many, many years, and I was going to Dr. Jennings and taking the cortisone shots in my knees because my knees were in such bad shape. So after that quit working, or not being a solution to my problem, discussed with him about replacing both my knees and both my hips. He told me what he suggested that I do if I was serious about a quick recovery was to start exercising and lose 20 pounds. And I took him to his word and lost 22 pounds. And but it worked out about 6 months, maybe 7 months, doing the exercise they gave me at joint camp.
It's very important to be doing an exercise program and to participate in a physical therapy program prior to your surgery in order to build up strength, to increase mobility. The more motion that you can have in your joint, either your hip or your knee, prior to surgery, the better your progress is going to be after surgery.
They wanted me to be sure that I knew exactly what I was going to be doing after surgery, and I was fully aware of everything that I was going to do, and went in, had my surgery.
So immediately, right away, with a total joint, you want motion. So right away in the hospital, you're usually there for 2 to 3 days. They begin on getting you up and walking. They work on starting to get some motion. After that, you will either go to a rehab facility or you will have home physical therapy, in which case we'll start taking the exercise program up a notch. We'll be increasing the strengthening exercises that you will be doing. We'll start working to gain more motion. You would really like to have 90 degrees of motion within, say, 3 weeks, 3 to 4 weeks after surgery. So they are going to start progressing on that point. Then I will usually see someone as an outpatient therapist in outpatient therapy, probably anywhere from 3 to 5 weeks post-surgery.
When I first walked in, they had all these machines to use, and every day stretching. She always wanted me to stretch, and we would just progress through the different machines. And I was here probably a month, 3 days a week, and I think the last day I was 130, 135 on both legs, and I was very elated over that situation. But yeah. I was discouraged in the hospital. I couldn't get past 84, and then when I came here, and it was remarkable how quick that these legs responded.
So, so when Jerry came, we worked very aggressively on motion initially. I do a lot of hands-on work, work on a lot of mobility of the kneecap, and we work to gain that. We use equipment such as a bike and hamstring curls so that we can get him to work on bending his knee. We work on steps. All that is to contribute to increase motion. As his motion increased, then we progressed a lot to strengthening.
All those years of getting your body beat up on the football and baseball field took its toll, and now I'm back to playing golf. The first couple of times I swung the club, I swung it very easily because I wasn't sure if I'd hurt anything, but they said, you can't hurt it, get back to what you were doing. I
think that we develop a good rapport with our patients. I think we're gently aggressive, as I like to say sometimes, is that we are considerate of their pain levels and their concerns, but we work aggressively to get the motion and the strength that they need to get back to their prior activity level.